want to welcome you all here this evening. My name is Elizabeth McClellan, and I'm the founder and president of Partners for World Health. And we're delighted to welcome all of you here to hear a little bit more about the PWH Medical Mission Program. And our medical mission program has been quite active since 2011 and traveling through many countries in Africa and Asia and South America. But this all changed in 2020 and early 2020 as the pandemic started to escalate. In January of each year, we usually host a medical mission to Uganda, and I returned from this trip with stops in South Sudan and Somaliland in January 2020 and have not left the country since. I thought what we would experience would be something like a wave coming in and going out, but we all learned quite quickly that that was not to happen. In fact, it was about a year ago around this time when restaurants had to close early on the night of St. Patrick's Day in an effort to prevent the spread of the virus. And in April 2020, PWH had to close its doors to volunteers and postpone our plans for any additional medical mission trips for the remainder of the year. The pandemic has been a challenge for all of us as we have faced job loss, potential illness for our family and friends, and we watched as our country tried to endure and set up measures to ensure that we would all be safe. There were struggles, and we all know that, but I can only imagine the struggles in so many other countries that lack a healthcare system for all, as we have here in our country. But we have been lucky, and look at us now a year later. Cases are decreasing, more and more people are being vaccinated, and our economy is improving. Life is headed back to a new normal. Yes, we should still wear masks and practice social distancing and good hand washing, but we are on a better road and we can see a future. And we here at PWH need to get back into the business of medical missions so we can help those less fortunate than we are who have been even further impacted by this virus on top of all of the struggles of just everyday living. Okay, so don't lose hope, because this is about to change. And so the team here at Partners for World Health and those who help to coordinate our medical missions have decided to offer an informational evening about our program. And we hope that it will offer you some insight as to how our program works, the PWH advantage, and the impact PWH has on the health of those in our world through our short-term medical missions. Okay. So our medical mission program, as I mentioned, started with a few trips in 2011 to Liberia and Cambodia, but really started to take off in 2012 when we traveled to Peru, Tanzania, and Bangladesh to provide education and training to healthcare workers and surgery and primary care to community members. Usually our medical missions are to countries where we have shipped a container and developed partnerships, but some others are also the results of contacts I have made in the world, been there to visit their facility, and for sure can see the dramatic need. As the years have passed, we have become more focused on the mission and outcomes of our medical missions. We keep track of the patients that we see, the cases and treatments provided, the types of education provided and to whom, and many other bits of information which are helpful as we develop more healthcare programs and potential grant support. And so we want to share with you the upcoming medical mission program being offered in 2021 through May of 2022. And we hope you will share this with your friends and family and others who might have an interest. And please remember that I'm more than willing to chat with anyone who's interested and answer any questions. And so before we start, just a few housekeeping details. We do have 4 door prizes, and we will be happy to answer any questions if you write them into the chat at the end of the presentation. Before we answer the questions, however, we will put your names in a basket and we're going to draw 4 names out of the hat for the presents. And if you're still here, we will be happy to share with you your present from Partners for World Health. And we look forward to answering any questions you may have. You can see here for 2021 into 2022, this is our list of places where we plan on having our medical mission program. Ordinarily, we would start in January to Uganda, Bangladesh in March, and Senegal in May. However, we are postponing those trips this year so we can make sure all participants will be able to receive the COVID vaccination before we travel. This will be a mandate going forward as part of our safety measures for all participants in the PWH Medical Mission Program. And it will also give us time to be able to recruit needed people for each trip, those with interest and skill. So we will start in Ethiopia in August, Bangladesh in October, South Sudan in November, followed by our return trip to Uganda in January, Liberia in February, Bangladesh in March, and Senegal in May. And so I want to share with you a bit about each trip and the different types of services offered and healthcare workers and volunteers needed for each trip. But remember, it is not cut in stone. And there's always flexibility, and there is much that everyone can do on a medical mission. And so to begin with, we are first going to Ethiopia in August, probably leaving the end of the first week in August for 10 days to 2 weeks. And there we will provide services in 2 different facilities, one in Hara and another one in Bale, which is down south in Ethiopia. We'll be doing primary care, wound care, hypertensive screening, and education and teaching. Workers about non-communicable diseases, cancer awareness, and also Project 10,000, which we'll go into. And this is just a photograph of some of the crowded hospitals that we will see. And participants, we need several different types of people on this trip, 3 to 4 registered nurses with primary care, wound care experience, education and teaching, 2 nurse practitioners or PAs that would function in our primary care clinic. This trip is also open to students, college students, nursing students, medical students, and 2 to 4 non-medical participants as well. We also will be doing Bangladesh in October, and that's quite a bit of a long trip. It takes us about over 24 hours to get there, and we will be working at the Dhaka National Cancer Institute and Research Center. And we will provide 2 3-day educational workshops at the National Cancer Institute on a variety of different topics related to care of the cancer patient, a GI cancer, OB/GYN cancer, breast cancer, et cetera. And participants that are needed, as you can see here, are registered nurses, pharmacists with chemotherapy and care of the cancer patient experience, medical and surgical oncologists, and pediatric surgeons. This is a 450-bed facility with all patients in the bed and not on the floor, mind you, but mostly stage 3 and stage 4 cancer patients. In addition, we are going to be doing a 2 3-day sessions at the National Dhaka Medical Center at their burn unit. They have 650 patients in beds in their burn unit, and then they also have several other hundred that are just everywhere because there are so many burns. And you can see here that we are looking for registered nurses, physical therapists, a social worker, pediatric surgeons, plastic surgeons, respiratory therapists. This is providing education and training to a group of nurses at the National Cancer Institute. Same thing here is Sarah Hoffman, who is a PA, works for Martins Point, and we also provide education and training to a variety of other nurses and other healthcare workers in different places that we visit in Tangai and Dhaka City. Our group of surgical team, one on the 4th one in from the left, is a doctor from Morocco who joined us along with Suzanne, who is a breast cancer surgeon at Mercy Hospital, and the team at the National Cancer Institute where they perform surgery. As you can see, and this is the burn unit. You can see Mary Burke here on the right. She is a physical therapist, and she traveled with us to provide education and training at the Dhaka Medical Center in their burn unit. And you can see the tremendous number of pediatric burns that are happening in Bangladesh, which they have declared actually a public health crisis in relationship to burns. It's a public health emergency. So we'll also travel in November to Bor, to South Sudan, We have shipped 2 containers to this hospital, and Ann Carroll and I visited there last December, Christmas of 2019, to see what the hospital was all about and to get a better understanding of what kind of a medical mission we could provide. And so we will be providing in November primary care, wound care, hypertensive screening, education on non-communicable diseases, and Project 10,000. Project 10,000, as many of you know, was done in Africa, in Sudan and Uganda, and we will add South Sudan to this, and Ethiopia, where we interview pregnant women and then we provide education and training about the complications of pregnancy for these women, and then we give them their birthing kit. As you can see here, for the types of participants that we need for South Sudan would be registered nurses with similar experience as we've been mentioning, some nurse practitioners to work in our primary care clinic. And if we do have an OBGYN surgeon, then we would be doing surgery as well. This is the typical hospital unit in the Bor, South Sudan, where we would be working with limited staff. When you have a patient load of 50 patients, you have about 2 to 3 nurses that are taking care of these people. So very different staffing mix compared to what we have here in this country. We also will go to Uganda in January, which is a 2-week trip. And in Uganda, we travel between Kampala and Manafa and Gulu. And we work at a variety of different hospitals there, providing education, training, primary care, wound care, surgery, and NICU education as well. So this is the NICU in Malago Hospital. Malago is a big 1,500 bed facility with another 300 to 400 patients that are everywhere on the floor. This is a NICU of 80 beds with with 80 beds and about 3 nurses that are taking care of 80 patients. So this is a big challenge. And as you can see, all of the cords all over the floor and all of these babies, because they're on these beds because they don't have enough incubators. And we provide, we bring a nurse practitioner with us who's a NICU nurse practitioner, and students and other healthcare professionals can spend 1 or 2 days working in the NICU and learning how to take care of these very ill babies. We also need on this trip a GYN surgeon, breast cancer surgeon, primary care physician, 2 nurse practitioners, a pharmacist would be great, and at least 6 nurses. We can also take 6 to 8 students on this trip and several non-medical people as well. Here you can see Anne, who's acting as the pharmacist that particular day in Manafa Clinic, and a non-medical person would also be working in that capacity or interviewing patients, and always under the guidance of a registered nurse. This is a picture of the birthing kits when I mentioned to you that we interview the pregnant women, and then we also provide them with education on complications of pregnancy, and then we give them their own birthing kit before they leave, which they can use and take to the midwife when they go into labor. We encourage everyone to go with this birthing kit to the hospital to have their babies because of the high maternal death rate and maternal and infant mortality rate in many of these countries in Africa. Wound care is a big deal everywhere we go. So we carry with us bags and bags, 50-pound bags of a variety of different items that we need to use in our wound care clinic, as well as hypertension screening, and we carry all the birthing kits with us. Usually we take about 400 birthing kits with us. And when we add it up, now we call this project Project 10,000 because I wanted to educate 10,000 pregnant women in Africa. Well, we're actually now up to 2,400 between Uganda and Senegal. So we're pretty excited about this program and the impact that it's having. Another opportunity for surgeons to participate in surgery in Gulu, which is a small 300-bed government facility, and then in Malago, which is that large 1,500-bed facility, as I mentioned. In addition, in February of this year, of 2022, we plan on going to Ganta, Liberia. And as you will recall, all of these places that we've mentioned have had containers of ours, and we have shipped 2 containers to Liberia in the last year or 2, and we will be doing a medical mission at the Ganta Leprosy and Tuberculosis Rehabilitation Hospital in Ganta, which is about a 4-hour drive from Monrovia, the capital of the country. And we will be providing primary care, wound care, some surgery, and education of local healthcare workers. This is a 177 bed facility with many leprosy type patients that have been, actually have a large community of about 10,000 people with leprosy within this 100,000 population area. And they're very excited about Partners for World Health coming for this program. So we need a plastic surgeon, if possible, prosthetics. We are actually putting a big push out there because we are sending another container to them this summer, and we are looking for prosthetic limbs, any prosthetic legs, hands, arms. So if you know of anyone that has moved on to a different type of prosthetic, please remember to tell them that PWH would be happy to take that so that we can ship it off to the Aganta Leprosy Hospital. We need physical therapists, occupational therapists. We will definitely take registered nurses, and we can also take some non-medical people. And then this is wound care. That is a big part of our program. And then we will return in March of 2022 to Tangai, Bangladesh, and work in the Tangai General Hospital in the Kandapara brothel, which is in the Tangai area, doing primary care services for the women in the brothel, teaching people about self-breast exams. This is a group of nursing students that are learning self-breast exam on the models that we make here in Partners for World Health. We receive these prosthetic breasts, and then we put pebbles in the bottom and stick them on a form, and then we teach people how to do the self-breast exam with these, and they have become a real hit all over the world where we have gone to teach self-breast exam education. And so we need registered nurses with teaching experience and nurse practitioners, female, that will be working in the brothel, talking and interviewing and treating many of the sex workers in the Tangai brothel. There are about 750 sex workers in the brothel, ranging in age from 13 to 60 or even older. And sadly, many of these young girls are put into the sex industry at a very young age. Some of them were trafficked in, some of them were actually born in the brothel. We're also looking for a general surgeon. The Tangai General Hospital is a 350 bed facility with 450 patients, and the other 100 are on the floor. So there's a huge need for OBGYN, general surgery, a pharmacist to teach, and we can also take 3 to 4 students on this trip, which is an incredible experience, meeting these women and learning about the culture and what happens in the brothel. A really incredible experience. It's a group of nursing students, first-year nursing students, all crowded into the room. They have large classes and a 3-year nursing program at all of the government facilities. And this is a group of women that came to our breast cancer awareness program. And out of these, there were about 100 that showed up, and we educated them about self-breast exam in one of the larger slums in Dhaka City. And this slum in particular was about 100,000 people, and there were about 100 of these women showed up. We were able to teach them how to do self-breast exam, and then we also provided screening, and we found 8 positive breast cancers out of this group of women. And these women are not teenagers. They're women that have had numerous pregnancies. They're 25 to 60. And many of them had had these lumps from didn't really know what it was and never really went to a physician. So it's really important to think about what we can do in our programs to help educate women about breast cancer. Because remember, if a breast cancer woman shows up with stage 3 or stage 4, she will have difficulty getting chemotherapy, surgery, or radiation, and that impacts the whole health of the family. And if a mother dies, then who takes care of all those children? So it's a big issue, and screening and prevention is really an important thing for us to provide. Senegal is a great trip, and I see there are a few people here on our call this evening that have actually traveled with us to Senegal, where we do primary care for the fish ladies. This is a group of women that I found that gut fish for a living in the hot sun, and we provide primary care for them. initially just for the women, but we've expanded that in the last couple of years to include their children and also their husbands as well. And they're an incredible group of women that are funny and delightful and very appreciative of the services that we have provided since 2012. Not last year, unfortunately, but we will be going back, or this year, but we will be going back in 2022. So we do primary care, wound care, hypertension screening, diabetes education, medication distribution, which is typical for many of our primary care services. And we also do Project 10,000 in the remote areas. So we need a GYN surgeon. There's a hospital there as well. Primary care surgeon, pediatrician would be great for our primary care services. Nurse practitioners, registered nurses with a variety of different experiences. And this is also a great opportunity for students to come in May. It's usually the last 2 weeks in May after students have finished with their exams and their college. And we also take non-medical people on this trip as well. So this is one of our medical students, actually, who traveled with us a couple of years ago, who's at UNE Medical School now, interviewing with an interpreter the patient who came into our primary care clinic. And this is one of our interpreters who's working with our nurse, who's working at the pharmacy that we set up. So we bring all of these medications with us, and if we find that we've run out of them, then we go to the local pharmacy and we purchase them, and we make sure that people have the right medication and understand when they should be taking this and for how long. So let's talk a little bit about, how do I get back here?
Left side, sir.
Logistics, okay. Let's talk a little bit about logistics. We provide, Partners for World Health takes care of all of this. We provide the air tickets to all the hotel reservations that we make. With the visas in most countries, we'll also let you know about that. Most of our visas you can pick up at the when we get it to the airport. We also ensure that we have interpreters. So if we have 15 people on a trip, we need about 10 or 11 interpreters with us. And those interpreters are people that would come from the country predominantly because they speak the dialect and then they also speak English. So if we're in primary care, each person would have to have their own interpreter. Otherwise, we would never get through the volume of the patients that we would be seeing all day. We also provide most of the food, double room hotel reservations as mentioned, and in some cases, we will do the credentialing for you. The costs are all inclusive of that and range in price between $25,000 to $3,000. We have long-term partners that we have found through our container program. So for example, where the containers have shipped, then we come back at some point, we meet them, we set up a medical mission for them. So these are people that we have stayed in touch with for a long time, and we communicate with them easily with email and telephones. So we have a really great relationship with them. They meet us at the airport. They organize all our in-country transportation. They and our drivers, because remember, if you're traveling with 15 people, you end up with 30 checked bags of luggage. That's 50 pounds each, plus 15 carry-ons. That's a lot of luggage to move around. And so we need a truck to transport it to our hotel. And then we need minibuses and other types of cars, because not everyone will be in one place, but you will always have contact, a way to get in touch with us, and there'll always be interpreters with you. The interpreters stay with us, they travel with us, they eat with us, and they become part of this entire medical mission. These are long days. Get up early, start early, and not get back until 7 or in the evening or so. And then we all go out together for dinner. These trips are not independent trips, meaning that if you want to do something independently and you've made other arrangements to friends that you know in the community, that's one thing. But we all stick together, and it's really important that we do that. So people that are looking for an independent medical mission, this might not be the right one. We all go out together to dinner together. We all participate in the mornings and in the afternoons in our programs together. And we've made a big commitment to go back to see these countries on a regular basis. And another one which we haven't been to, which we are going to go to in November 2022, is South Sudan. South Sudan is in desperate need of assistance, and we are committed to helping them out and going back there on a yearly basis. We were planning on going back in 2020, but because of the pandemic, so much has changed for everyone. We distribute the needed medications, we bring the supplies with us, and what we don't use, we end up leaving behind. And we develop programs like the Rising Up Project in Bangladesh, which is one that we want to do with setting up a social enterprise so that some of the sex workers that are interested in taking a right-hand turn can get out of the brothel. And then we also are working on a grant right now for community health workers in Project 10,000, so that we would be able to continue that project in various countries year round instead of just doing it on at those times when we come on our medical mission. So those are some of the things that I think make us unique in that we take care of almost everything. We don't take care of your medications, however, we will give you some advice and some suggestions on what we would recommend for vaccinations, especially the COVID vaccination, which will definitely be a mandate. I think that will end up being a mandate for many countries in our world, just like yellow fever vaccination is a mandate for going into countries into Africa. So if you have had the opportunity to have your vaccination, don't lose that little card. That's going to be a very important piece of paper that you should probably attach to the inside of your passport. So a few other things. I'm going to share and have Laura speak a little bit about this. Laura is our Partners for World Health Operations Manager, and she joined us almost a year ago in that position, and she's been doing a great job running our operation here and working with interns and bringing in inventory, packing it up again, shipping it over to Kenko so we can ship it off in containers. And she's going to go over a few little tidbits about our process here, and then we will answer any questions.
Hi, everyone. So as Elizabeth said, my name is Laura. I'm just walking you through next steps in the process. So hopefully we have convinced you that you're interested in one of our medical missions coming up in the coming year. There is a link on our website. So if you're navigating, I'll show a screenshot in just a second, but under the medical missions tab, just click medical missions. And there is a link at the bottom of the page that says medical mission interest form. So that's where it all begins. We're going to gather just your basic information. You know, which mission are you interested in? Your name, email, phone number, address, pretty much how we can contact you. Just making sure that you have a passport, or if you don't, letting us know that you don't. Your COVID vaccination plan, if you have one, whether you speak another language, your employment or student status. And then we're just asking kind of what skills you bring and what you think you have to offer for the medical mission. So this is a good opportunity for those non-medical people to express their experience, maybe traveling in the developing world, maybe you have great administration experience, but as a medical professional, maybe you have skills working within, you know, pediatric surgery in a developing world you've been to as well. So you have the option to list out those items there, and then letting us know when you're available. So one of the other advantages that we didn't list is that we chat with everyone about what mission is best. Elizabeth will hear your experiences, what work you've done prior to the missions, and sort of guide you in the right direction. I think we have a very good range of missions available with different experiences on each. So perhaps you may think you're interested in one, but your skill set matches another. So we'll have that conversation and get you on the right mission. So we'll chat with you then. After that is complete, we will ask you to submit the formal application. At that point, it really is a formality. So you're going to be filling out, you know, the basics again, but in more detail. So asking for your passport information, perhaps your credentials if you are a medical professional, asking for diplomas, things that we need to submit in order to have you working in that environment. We'll have you submit your visa information, so making sure that you have the visa. We'll get all your travel logistics planned accordingly, and we'll gather all that information, hold it for you, and make sure it gets to the right place. Of course, there's payment involved. We want to offer just guidance for students. So if you're a student and you're interested in thinking, how am I going to pay for this? We highly encourage you to reach out to your own school. There's a ton of grant opportunities, even if you're not a nursing student, even if you're, a business student like I was, there were grant opportunities for me to go on missions like this. So reach out to all your departments, the heads of your department, your, service learning departments, everything like that. So really do your research. And we want to encourage you to contact Zoe, our volunteer coordinator, who has a lot of experience in this realm. So it's just zoe@partnersforworldhealth.org is our email. So if you're a student with questions, that's a great place to start. The logistics will come next. So again, as Elizabeth mentioned, that's one of the advantages of going on our mission programs. We will arrange everything for you, let you know when and where to arrive, essentially. One great thing is that we all arrive to the final destination together. So you may be coming from anywhere around the world, anywhere around the US, but the final flight is always together so that everyone comes in to the country through customs as one group, which really helps get everyone started off on the right foot. We also do a custom orientation about 2 weeks prior to the program. So we'll go over, everything from what to pack to cultural norms in the location where you're visiting. We'll go over, of course, the schedule and the itinerary, which is always subject to change, but we try to get a little bit of a groundwork laid at least. Goals and objectives, really get you thinking about why you're going on this program and what we can do together as a group. And then finally, we will be off. So once everything is complete, you can obviously see that Elizabeth and I are very enthused by these programs. And I know that Elizabeth can't wait to get back out there. So once we're ready to go, I think it's going to be really great from there. So if you have any questions about next steps, you can certainly ask them in the chat.
Great.
One more.
What?
Mm-hmm. Okay, so this is the screenshot I was mentioning. That's our website. You'll see medical missions at the top. Click that first. You can scroll down, read through that information, of course, but it might be a little redundant at this point. And click the medical mission interest form. So that will bring you to a new tab. You'll be able to fill out just the basic data, nothing crazy at this point. And then we'll get you in our system. We'll start to have those conversations and get your application started.
Great.
One more.
Oh, here we are. Yeah, here we are. This was when we were in Senegal. Actually, yeah, it was a great trip. And it was way up north in staying at the FAM hotel. And it's a great little place. And we visited Touba, and Touba is an incredible place in Senegal with a huge mosque that many of the Islamic people travel to as a pilgrimage to this incredible place, and just an incredible place. And you will go there if you come with us to Senegal. So before we go into the chat and answer any questions, we have a few surprises, few presents to give away. So we're actually pulling something out of a name out of the basket right now. And this is a Ugandan basket. And we will make sure that Donna Ames, is Donna Ames still on the chat? Still on the program?
So we will find out.
Can you let us know, Donna, if you're here?
Yes, I'm here.
Terrific.
Congratulations.
Congratulations,
Thank
Donna. We will have this at PWH, but if you need it to be mailed to, we can make those arrangements too.
Okay, I'll plan to come pick it up.
Okay. So this basket, I just want to mention that these baskets that we pick these baskets up in Uganda, and we usually bring home 300 of these baskets in all different sizes to Partners for World Health. And then in July of this year, we will host our International Handicraft Fair that we couldn't have last December. So we have a variety of different handicrafts from all over the world that will be available in July. So we have our next item that we just pulled the name out. This is a group of coasters that are made out of African material from Uganda, made in Uganda. And this is going to Roland Gagny. Is Roland still on the call? Yes? Mr. Roland, are you there?
We'll save these for you.
We'll
I
save
think
you-
tomorrow he'll be in.
Okay, we will save those for you, Roland. And the next one is this vase that was made in Peru. And we have almost 6 or 7 pallets of different artifacts from Peru donated to us by a very generous individual in Cape Elizabeth who is originally from Peru. So these are going to be available as well in our handicraft show. And today it's going home to Tori Denavilas. And Tori's here. So Tori, we will hold this for you. And the next one is going, this is a Peruvian metal plate and painted. And this one is going to Jennifer Audette. She's on. Everybody's on. That's great. So
Good
glad.
sign.
All right. So we will make all of those available here at Partners for World Health. And if you need them to be mailed to you, just let us know and we can figure that out. So now we want to deal with any or answer any questions that anybody might have had.
I'll read them all, so I will read them.
How do you obtain interpreter services, and is there one for each healthcare practitioner?
Yes. So our partners that we work with within the country are responsible for reaching out and finding the interpreters. Most of the interpreters are women, and I have found over time that they have been the best ones. And they are usually medical students or nursing students, maybe are teachers. And I'm thinking about some of them in Senegal. If we have, as I mentioned, 15 people on a trip, we need about 11 interpreters because we cannot work through a volume of patients that might show up like 350 people in a day without one-on-one interpretation. These are people that are speaking a different dialect, not French or not German. They're speaking a dialect in their own country. So that becomes a challenge. So we don't bring interpreters with us. We have our contacts over there reach out and find the interpreters, and we pay for those. We pay for them to participate in our program as well, because they're spending hours and hours with us from the minute we start to the minute we drop everybody off when we get home.
For students to come on missions, must the student be a part of the PWH chapter?
No, the students do not need to be part of the PWH chapter. We do encourage you to be a part of the PWH chapter because there's lots of other different things that are going on, and we're looking for more and more students to be involved in their chapter, to do outreach, to help with gathering supplies, to help us with different programs that we might have going on. We'd really appreciate that. But students do not need to participate in a chapter if they're interested in going on one of our medical missions. But you do need to speak to me because I need to talk to you and find out what your interests are and what you really want to do.
Will you be doing a trip to Syria or Lebanon again?
Well, I went to Syria actually before the war started. And the war, as you know now, has been going on for 10 years. So I was in Syria probably about 15 years ago via Lebanon. I was in Lebanon and I had a driver and drove all the way to Damascus. It was an incredible experience. We're not able to go into Syria now, and we won't be able to go into Syria until the war is over, and it's not ending anytime soon. However, we have participated in primary care and education opportunities in Turkey and Gaziantep, which is in the western part of Turkey, and down south in a village called Rahali is where many Syrians have come across the border to seek refuge and have also come there to have health care because there have been so many injuries in Syria. We've worked with SAMS, the Syrian American Medical Society, SAMS, the Syrian American Medical Society, which is a group of 5,000 board-certified Syrian Americans, physicians here in this country that are providing services for the Syrian people. Some of them go into Syria. They are originally from Syria. They speak the language. They're able to get in. But a lot of them go to the different refugee camps that are in Turkey to provide services, primary care, surgery, and education and training. And I've worked with them several times. If we were to do a primary care mission with SAMS again, it would be focused on education and training, and those Syrian physicians and nurses would come across the border into Turkey, and that's where we would provide the service. But stay tuned, because last week we sent a container to Syria. We're sending 4 containers to Syria this year, and the first one just left. And one of the things that happened to go into that container was my brother's physical therapy table. And he died several years ago from complications of multiple sclerosis. And we were able to ship his physical therapy table. And I wrote on the back, you know, that this belonged to my brother with his name and that my name is so-and-so, and we're delighted to help the Syrian people. And someday I want to come and find that physical therapy table. So stay tuned.
Lebanon?
Hmm?
Lebanon?
We've never done a medical mission to Lebanon. We did send a container to Lebanon last year, actually, through our contacts that we work with in New Hampshire that provide services for Syria. And we would have to work on identifying an organization in Lebanon that would want to partner with us. So if you do know of other healthcare organizations or nonprofits in Lebanon that would like a medical mission or would like us to come and help them out, please let us know. I'm more than happy to investigate that. You know, the other one are the Palestinians refugees. You know, they're in a pretty dire state as well and definitely need help. So lots of places. So if people, we're interested in other contacts. So if you know of other people out there, then just let us know.
Are high school students allowed to come on the medical missions?
High school students are more than happy to come on a medical mission if you bring a parent. So the minimum age is 18. We're happy to take college level students and above, but high school students would have to come with a parent. We'd be happy to have you, but just bring your mom or dad.
What are the new dates of the Uganda mission?
The Uganda mission will happen in January and will probably leave here around the 3rd or 4th of January and return around the 15th or so. Depends on how the plane tickets, how the plane travel goes at that point in time. We tried, that's a good, we try to go in that time frame because students are still on holiday at that point in time. Now, it may be that you need to come back sooner because you have another commitment with school, or it may be some people could stay a little bit longer, and we can work with you on that. But we do like to have everybody leave at the same time. They may leave, as Laura said, from different places in the US, but meet up in Dubai. And we all kind of know each other in Dubai, even though we've never met before, because you're going to have blue wrap tags that are on all of your carry-on luggage. And that way, that's the way we're going to be able to identify people. And we'll all be looking for somebody, so we'll find each other anyway. And those people that are coming from away would not here directly in Maine would we would ship you your 50-pound bag, we get 2 pieces of luggage when checked, and we would send you your other 50-pound bag full of medical supplies that then you would check where you check in at the airport on your way over. And then we look for you in Dubai or other places.
What are some ways that PWH gets our funds?
What are some ways
That we get funding?
That we and Partners for World Health, we have a variety of funding sources here at Partners for World Health. One, we received small grants that we apply for. 2, we have an annual appeal and a summer appeal, which many people have been very generous, I must say, this past year to help support us through the annual appeal. We have opportunities with our medical supply program. We work with over 120 different organizations here in the state of Maine, providing discounted wheelchairs, walkers, crutches, beds back to the local community. We also provide adult diapers and bed pads for free. So if you know of anybody who needs those kind of items, then just let us know, because you can drive down and we'll pack your car and give them away for free to people. And sometimes that can be a difficult expense for many, and we get so much of that in here that we're happy to just give it away for free. And another note on that, that's not something, we do send some of that stuff in a container, but they don't need 25 boxes of diapers or bed pads. They need 25 boxes of wound care supplies. So we have to be, what is the right thing to do? What is the ethically right thing to send? We also charge for shipping and processing fees for our containers. And that's one way that we help to survive. And we also have opportunities through a third-party reimbursement. There are third-party organizations in our country that will purchase expired goods. And we get a lot of expired products here that we wouldn't necessarily send to our clients because they don't have a cardiac cath lab, for example, or they're not doing invasive robotic surgery, that type of stuff. And so there are organizations here in the United States that we have learned about, and we partner with them, and they purchase these items, which is great for us because it means, number one, we don't have to take them apart, and number two, we don't throw them away in the dump. So there's actually a way for them to take ownership of these, and then what they do is sell them back to the secondary market, to other countries like in Central America and South America. There's a big market out there for expired products. So that's in general how we raise our money. You know, running a nonprofit is an important effort, but you should run it like a business, because if you run it like a business, then you will always stay in business. And being dependent on grant funding or donations all the time is not the way to do it. We have to create sustainability. We have to figure out how can we create a model that will sustain itself. And we've done a pretty good job with that over the years here at Partners for World Health. So we're here to stay. We are not going out of business. We are going to grow our medical mission program. And if not all of you may know, but we have a warehouse now in Massachusetts, in Millbury, Massachusetts, one in Burlington, Vermont, one in Portsmouth, New Hampshire, two here in Portland, Maine, our shipping center and our distribution center, and another one in Bangor and Presque Isle. So we are here to stay, and I want it all. So if there's people out there or organizations out there that are throwing things away, you just let us know, because we would like to talk to them.
Because Bangladesh is a longer mission, is it a lot more money?
No, Bangladesh is on the higher end of about 3,000. It's a longer mission because it takes so long to get there. When you leave here at 7 in the morning, you don't arrive. You leave here on a Thursday at 7 in the morning, you don't arrive to our final destination until 7 o'clock on Friday night. So it takes that much longer to get there. So and you're really tired. So we extend it to about 14 or 15 days. And it is in that ballpark of around 3,000. Our partners over there are the Rotary Club of the Dhaka Mavericks. And these are people that I've known for years. When I first went there was in the fall of 2011. An incredible country, one of the fastest growing economies in the world, and with 167 million people that are living in the size of the state of Iowa. So just imagine how many people that is if we think about what we have here in Maine, only 1.3 million. So there are a lot of people, and a lot of people that need help. So we have incredible partners that work with us to meet us at the airport, have the transportation all lined up, the interpreters all lined up, everything lined up.
What is expected for non-medical personnel to do on missions?
Oh, there's a variety of things for non-medical people to do. First of all, we'll teach you how to do a pulse and teach you how to take a blood pressure. You can interview patients, and with the support of a registered nurse, you will be registering patients as they come in. You might be the administrative person, kind of making sure that nobody jumps the line for the day. You might be interviewing pregnant women and gathering that data that we need to have when we initiate Project 10,000. You may also be participating in wound care with the assistance of a registered nurse, and you will also participate in discharge teaching, where the patients go through, see the provider, they get their discharge plan, and then they go to the pharmacy. You might also be assisting a registered nurse in the pharmacy administration, or doling out the pills, counting the pills, figuring out which medications are on this piece of paper, and making sure that's double checked by a nurse or a pharmacist if we have some with us. You may also feel comfortable teaching. I know that a couple of people that were public health were focused in on smoking cessation, and they were able to develop a PowerPoint, and then they taught that PowerPoint. And when you teach in these developing countries, you're also teaching with a interpreter. So your 15-minute PowerPoint becomes a half-hour PowerPoint, because you're learning how to teach by making a short comment and then having it being interpreted. So there are a variety of different things that non-medical people can do.
Do you plan to go to Central America in 2022? If so, what country, or 2023?
Central America, that's a very good question, because we just finished sending a container to Honduras this year. I think it went out in January. We also sent a container to Jamaica, and this is our second container into Jamaica that is sponsored by a US-based foundation to support certain hospitals in Jamaica. And we're in the process of working on another container to Guatemala. And we have in Central America for those, and then also Ecuador in South America. So we haven't been to any of those countries. So in some of those cases, we would want to see if we could develop a medical mission for several of these places. Ecuador will receive its third container from us. So they've kind of ratcheted up to the top of the ladder, so to speak. And Guatemala is in conjunction with a incredible woman that I met through Zoe, actually, through Zoe's father, who started an export business of fruit and vegetables 35 years ago, and has created this incredible business down there for and employing hundreds of Guatemalans, and also does a lot with education for schools as well as healthcare. So we're looking forward to trying to develop a presence in Central America on our medical mission program.
That was the last question.
That was the last question. Okay. Well, are there any other questions? We'd be happy to.
Lodging.
Hmm?
Lodging.
Lodging. Well, we stay in a variety of different places in these hotels. Laura just reminded me, they are not 5-star hotels, I will tell you, but they're not negative 2-star hotels either. They're kind of in the middle, 2, 3, 4-star hotels. What I always say to people is that you will be in a place where you have clean sheets, you have air conditioning, and you have hot water. And those are my 3 mandates. And usually, 99% of the time, that's what we have. There might be one night when we don't, but most of the time we do. And the reason that's important is that this is a different type of an environment and not one that we're used to here in this country. So I feel everyone needs a good night's sleep. They need to go to bed in clean sheets. They need to have a hot shower in the morning so that they can wake up refreshed and they can go off and do this again. Some days are great days for everybody. Some days are sad days for some people. Some days are so emotional, you just can't imagine what you went through that particular day. And at dinner time, we always have a wrap up at dinner, and we go around the table and everybody comments on how their day was, or some of the challenges that they might have experienced, or some of the funny moments, whatever it might be, so that we can share those experiences. This is not in a housing situation where we live with families and experience that type of a cultural exchange, because I can't guarantee that you might not have guarantee that you would have a bathroom, or maybe you had to go use the outhouse. So, and when you travel with Partners for World Health, we all stay at the same hotel. Our drivers pick us up in the morning, bring us back in the evening. We always have good food and a variety of choices, clean sheets, air conditioning, and hot water. Any other things I should comment on? Well, we really,
If you have questions, you can email medicalmissions@partnersforworldhealth.org.
okay. And if you do want to call, or do call us, and we'll be happy to give you a call back. And we want to thank you all for coming tonight on this Zoom presentation. And I'm really looking forward to seeing all of your faces someday in real life, because I know we're all kind of getting old, getting tired of this Zoom business. But it's good that we can communicate this way. And we're on the downside of our pandemic, which is also really great. So thank you very much for joining us. And I look forward to hearing from you and seeing you again in the future. All the best.
Thank you.
Bye.
you.
We just stopped the meeting.
I'd just like to see them. 15. Oh, they all, yeah, they're down to 15 now. Bye. Bye, Jeff. Bye, Donna. Bye, Arthur. Hi, Art. I see you, Art. How are you? You're on mute.
Yeah, I unmuted him. Oh, there's Josh.
Hi, Josh. Hi, Art. How are you?
I miss you. I'm lost. I'm a ship without a rudder.
Oh, well, then you need to come over here.
I do. I haven't been working for 2 years. I'm lost. I'm
Oh,
lost.
oh, Art, come on over.
I'll write you.
We have a
Yes.
lot to do.
We have a lot to do. I think you might enjoy it.
I hope so. Thank you.
You're very welcome. It's great to see you. Art,
It's wonderful.
Art is an incredible registered nurse who worked for many years in cardiac intensive care unit, with all those open heart patients, keeping those people alive. It's really great to see you again.
It was only 25 years, but it felt like 100. Okay, bye.
Great. And Josh, it's good to see you too, Josh.
Hey, Josh.
Josh is one of our co-presidents of the PWH chapter at University of Maine in Orono.
Yeah, and I hope you don't mind, but I had a quick question for you.
Sure.
I added it to the chat towards the end, but it got cut off. My hands are kind of freezing right now, so it's hard to type fast enough. I don't know if this will be the case when you resume travel, but right now I believe that you need a negative COVID test to return to the country if you travel internationally. If that's still the case when you travel, whenever you resume travel, do you have a plan for how to achieve that for people who join you on the trips?
But when we start to investigate, like our first trip is going to be in Ethiopia in August, we here at Partners for World Health will figure all of that out, because we are going to need a negative test when we come back. And people have been able, from people that I've spoken to that have come back into the country, have been able to get those fast tests at the airport. But you actually, right now, you need a test 3 days in advance. That's
Yeah.
before you, and you have to bring that paper with you when you come to the airport. So that will be our responsibility, to find out how are we going to do that and where are we going to do that. And we would reach out to our partners that would make sure that if we all have to have that test 3 days before, then we have to have the test 3 days before. So
Great.
we'll figure that out.
Yeah, we have to get back in too.
Yeah. We would not leave that. We would not leave that to our participants on our trip to figure out. That's a big deal. We've got to get everybody home.
Right. And I just want to say quickly, you might notice the background behind me. I've got a projector up and you'll see the Partners for World Health sign. We're actually in the church right now and we're sorting. And I have people here sorting, working, and attending the meeting right now at the same time. So we have a lot of interested students who I'm sure will want to reach out to you sometime.
Take a picture.
The picture. Josh, that's great. So
Yeah.
we have a church, a small church group up in Bangor had reached out to us a couple of years ago and wanted to do something with helping to collect. And so we connected them with the students. And so they have offered their church, which is where Josh is right now, and they go and pick up the supplies, the medical consumables from a variety of facilities in the area, and then they come over. And now what the Bangor the UMaine PWH chapter has done has set up sorting mechanisms the way we do it down here, so that things can be boxed and all of the syringes can come down at once, or all of the gauze can come down in a box. So this is really great. Thanks, Josh, for doing that.
Thank you and have a good night.
Thank you to everybody
Take
else.
care.
Bye. Okay, thank you very much to everyone, and we're delighted that you are here, and we look forward to hearing from you. Arthur, give us a call.
Do we hit stop share? Stop share?
No,
Stop the meeting?
Oh, yeah. no.
Yeah,
Okay.
okay, and now end.
End.
Do we stop the recording first or just end? Yep,
And
end
Like that.
meeting for all.